Hi, I'm Doug Dormer. I'm an instructor at Indiana University in Indianapolis in the Department of Biomedical Engineering and Informatics. I teach master's students. In the fall semester, starting today for the fall of 2025, I'm teaching a class B641 on the business of health informatics. Now, you might also think of that as perhaps better titled The Economics of Health Informatics, implying that we're looking at more than just the mechanics of the business process and the revenue and expenses, but really trying to think about the economics. What role does health informatics, health information technology play from a business perspective in the healthcare universe? Now, I teach this class over 14 weeks, so I think of each week as a module. For my students, I offer lessons within each module. So each module will have a broad topic and then maybe 10, 12, possibly 15 lessons within that module, each one being about 10 or 12 minutes. So each module is about, 2 hours, 2.5 hours of collective information. A lot of my friends over the years have said, why don't you make some of that available to the general public, to other friends, colleagues? Well, for a bunch of reasons, that's not a practical idea, not the least of which is it's more information that most of my friends really want. Who wants to invest 2.5 hours a week on this stuff besides me? So I've decided to offer 1 or 2 sessions a week, essentially from every module. I begin with In the News, a lesson that covers what's going on right now that might affect healthcare IT generally, and then also a 10-minute or so overview of the module and what we're going to cover. Now, I think those two might be interesting to my friends generally. So I'm going to use this one video recording to, well, along with some very good video editing tools, to reduce it for both purposes. So I should have 1 or 2, 10, maybe 20-minute videos total for my public audience, along with the 2.5 hours that I give to my students. So with that, let's begin Module 1, Lesson 1, an introduction and overview for the economics or the business of health informatics. Now, I'll always begin with an agenda, talking points for the day. So as I said, we'll have the In the News in the public module, which is our overview, which is our public module. Then in the second lesson, I'll talk about myself and the course requirements. And in the third section, which will be more for this one lesson than 10 minutes, we'll give a brief introduction to the business of healthcare and the role that HI, HIT, you'll hear me refer to those somewhat interchangeably from a business perspective. And then we'll talk about our first assignment, the Slack discussion group around a particular topic. Let me begin with a politics disclaimer. I will never express a political view in this class. For purposes of this class, it doesn't matter whether I, as an instructor, or students, or those watching this video, are conservative or liberal or anything else. And in fact, I'll warn my students, if you wish to present your political views in your papers, in your work, I can't imagine how that would help. And in fact, I think that will hinder your grades. But at the same time, the consequences of political decisions is very real. And we will spend a lot of time looking at not only what's going on in the world today, but also considering the changes that are proposed and what their effect would be on healthcare broadly, but specifically from the perspective of health informatics and health IT professionals. Let me begin with the In the News for today. And I have to say, this started out with really only one In the News item when I started writing this particular, the content for this particular module on Monday in this past week. Today is Thursday, by the week, the Thursday of the 28th. I started on Monday the 25th. And the first thing I found was updating my work on the corporatization of U.S. healthcare. I found this interesting piece from the New England Journal of Medicine. Came out on July 2nd, and it's the first in a series talking about the corporatization of the U.S. healthcare universe. And it's a series, so already there's a second one, I expect, dated around August 1st, August 2nd, and I'll include that in a subsequent module. Now, when I do this, I usually, that is to say, when I do this in the news, I don't usually present detail from the article because that's the point of go look it up. I'll tell you about it, but go look it up, read it for yourself. In this case, I wanted to get some of this out there. So this is a quote from that short article, this first article in the series on the corporatization of healthcare in the United States. You can read it. I'm not going to read it all, but it points here to a couple of key things. The trends toward corporate ownership of healthcare organizations, market consolidation and concentration, and the emphasis on the bottom line are widely seen as primarily benefiting corporate executives and shareholders. Clinicians are becoming increasingly demoralized and are either seeking viable ways out of a system that they feel treats them as cogs in a wheel or attempts to fight back with collective bargaining. Patients of financial means are following their doctors to concierge practices, and lower income patients are getting increasingly lost amid ballooning patient panels, the prioritization of checklists and billing over humanistic care, Byzantine insurance requirements and administrative burdens, and ever narrower provider networks. Holy cow. What an indictment right off the bat of the healthcare system as a whole. Now, we can argue that that's just an opinion. Again, I go back to the source, the New England Journal of Medicine, which is not exactly a liberal, progressive journal. And I have found it to be a wonderful source for evidence-based practice, giving real-world information. So we have to begin by acknowledging that one of the trends, at least, this trend relating to the corporatization of healthcare, is having a huge effect on healthcare broadly, and we'll be considering what's the effect for us as health IT practitioners. Now, feeling a bit nervous because I'm going to go to another editorial. This one is a true editorial. It is from the New York Times on August 24th, which is to say last Sunday, this past Sunday. America first, not when it comes to your health. Now, I don't generally go to opinion pieces, but this one really constitutes, has a video that includes commentary and discussion by at least 6 researchers, health researchers, talking about the effect of real-world cuts in research funding. So the cuts in funding are not opinion. The impact on their practice may be opinion, but it's real world for them. And again, I think it has to be something that we keep in the back of our mind as we begin this process of thinking about the business of healthcare IT in this fall of 2025. Now, to go the other way and to show you the breadth of the idea of what's in the news, I can't quote the source for this. This is a personal piece of information, and I'm going to encourage my students to include this broad definition of what's in the news. So in this case, I heard about one of my colleagues who is the chief revenue officer for a health IT related company. And so I sent him a note and said, hey, I hear you as the chief revenue officer, essentially sales and marketing and somewhat customer support, are using ChatGPT in your environment. And he wrote back, and here's what he wrote. You can read it all, but the key idea from it is I basically needed a way to add a field anywhere in any of my applications on behalf of his clients to allow the user to enter a search term and then append that search term to a URL and navigate to the resulting page within their overall application. And it took him about 15 to 30 minutes using Claude, a wonderful product from a company called Anthropic. We'll look at that later in the semester. And he had a working version. And as he says here, definitely was a win in terms of the optics as well. Our CEO was very happy I was able to create that. So this is a profound piece. I call it in the news. It's news for me. And I want to encourage each of you to think in terms of news, not just published things, but the things we learn from our colleagues. And in this case, finding that the chief revenue officer is able to use Claude to write code that he can overlay or plug into their application, a whole lot of specifics we don't need to go into there, is really a compelling argument for the evolution of how technology is developed and how it is delivered, and indeed in the role of the health IT professional. So interesting stuff. Finally, and this is straight news, although I can see it feeding into an opinion piece later. From our view, it's pretty clear. Medicare announced today that they will require prior approval for certain procedures. Now, I also see this is a common practice in private insurance. Before you can have that surgery or that therapy, you need to get an approval from the insurers, the payers. And when that happens, and that's private pay, this has been around for some time, and in fact, there are some significant lawsuits going on right now where the argument is that this pre-approval process is resulting in unnecessarily denied claims or extra burdens and stress for patients in order to get to the surgery that their clinicians have told them is the appropriate treatment for their condition at that time. So those are my 4 in the news articles. Not certainly a happy case, but they present a definition of the universe. They give us some color to the world in which we will be discussing in this semester, the business and the economics of health IT. So let me introduce you to the domains, the 4 domains that I think are when we look at this class. The first is the business of health IT. We'll be talking about how do organizations, healthcare providers, healthcare organizations of whatever sort, make or lose money, and what role does HIT play to contribute to that business value, to that profitability. That profitability will generally refer to as sustainability, rather than making it loss, have a make money or lose money. They'll refer to it generally as sustainability, the ability to remain in business. The second domain, which we'll talk about, is the economics of HIT, where we want to learn to look around the corner to say, what's the effect of this new policy or this proposed policy? And particularly for our health IT professionals, if you think about your first role working with your advanced degree for an organization, they're not as likely to ask you, do you know how we do business today? They already know that. Certainly it's valuable to know how that works and be able to fit into their organization. But they're more likely to say to you, with your advanced training, what's the effect of this new legislation, this new policy, this new technology? How should we react to it? Help us look around the corner. We refer to that as the economics of health IT. The third thing we'll talk about is the evolving technical landscape, including, of course, the business and economic impact and implications of artificial intelligence. It's hard to overstate how significant they are and how important this particular time is. We'll have some fun with that, I think. And finally, we will focus on not just knowing these things, but how do we use these to make a compelling case in the business world to show that our understanding and our proposed solutions are the best solution when compared against when management has to compare them to other alternative investment decisions. So I'll be teaching a model for how to identify a problem, how to evaluate and quantify the harm that problem will cause if it's not addressed, how to identify solutions and describe the scope of that solution, how to evaluate that solution, both financially and from a performance perspective. So those are the 4 domains that we'll consider this in this semester. As we do that, there are 3 trends I want you to have in the front of your mind. We'll be talking about, as I already started, the corporatization of healthcare. We'll drill into that in considerable detail. We'll also talk about the coming age of consumer and patient empowerment. I put a question mark here because I believe that this is true, but it's an early enough stage and it's ambiguous enough that it's worth saying we don't know how this will play out. But between technologies, as the example I gave earlier, where the chief revenue officer was able to develop a technology solution, and in that way demonstrate something that's also available to patients in their own care, to the commercial, the consumer aspects of healthcare, I think we are looking at a coming age of consumer and patient empowerment, and we'll have some reading assignments to that effect. And then, while we want to stay away from the politics, we cannot avoid, we don't even want to avoid, the political struggle and the right of access to healthcare. Now, I put it that way carefully because when you reduce most of the policy questions that are in debate, the political questions today, boil down to a question of what right do Americans or citizens in other countries have to healthcare? Is it a right, or is it an option that they can purchase? And that debate is at the core of so much of the funding and the legislation that we see and the whole political discourse. So those are the three key trends we'll be talking about. We'll also talk about funding, and I want to view it right now from the, I would say 30,000 feet level, which is a common phrase. In this case, we'll say from 10K meters, 10,000 meters, about 30,000 feet. First, we'll be looking at indirect costs of delivering healthcare. Revenue comes from providing services, and the costs of the HIT solution, the electronic health records, the analytics, the communication tools, the security and privacy, all of that is buried as a part of the infrastructure and underneath it. How will we look at it from that perspective? We'll also have to look at research, where the revenue comes from public or private grants, and the technology, the health information technology, may be just an allocation of existing technology, so it's indirect as it is when we look at revenue, but it may also be much closer to the solution that's being tested. In both cases, we're seeing an evolution towards technology plays a role much closer to being the actual delivery of the therapeutics. We'll talk about software as a medical device, for example. We'll certainly look at the role that technology plays in all research, evaluating it, capturing it, demonstrating it, communicating it. But these two areas are very different from a funding point of view, and we'll be exploring that difference as we go through the semester. I'm not going to linger here. I'll bring it in more detail with my students, but you can always freeze the slide and take a look. This is the 14 modules that I see for this semester, along with a summary of the assignments. Now, these do not include the discussion assignments that we'll be doing in Slack, but they're just the general assignments related to the overall project we have for this course. And so you can see here, we'll be talking about the macroeconomic view, the micro view, the big picture, the forest. We'll also look at the micro view, looking at the trees, if you will, individually. We'll talk about federal government models, Medicare. We'll talk about state models, Medicaid. We'll talk about commercial models. We'll talk about the ways in which AI can affect business performance. We'll talk about all of the evolution in each of these areas, and we will focus on a project to identify a problem, quantify the harm in that problem, design a solution, evaluate the financial impact of that solution for an organization, and then determine what criteria we'll use to evaluate whether that solution has been successful. So I think it promises to be kind of a fun semester, rather exciting, not just of memorization and learning, but really of trying to apply it. Now, I do want to say in last fall, which was during the time of the up to and included the election, the presidential election, I asked my students to, as a part of their papers, make a comment and a recommendation about what solutions they might present that would do well in either a Republican or a Democratic administration, and to evaluate the political landscape. That paper was their individual papers. I then consolidated into a larger paper and published on ResearchGate, one of the better sources where you can publish a preprint. So it's not been peer reviewed, but I think it's really interesting work, and it shows what my students are thinking as they consider the problems of the day. I don't know where this will go for this semester, But I hope we find that the project and the work results in something that we can publish and that will stand outside of just an assignment in our class. So for my public audience, thank you for watching this. If you're interested, stick around and come back next week. Drop a note in the comments and let me know if this is a benefit. And if you'd like to see some of the detail in this or in subsequent modules, be sure and let me know that as well. And we'll see if we can't find a way to accommodate that. And for my students in B641, please proceed to Module 1, Lesson 2, where I'll give you a little of my background and we'll talk about the course requirements. Thank you.